Hello, I'm Jessica Samuels. Welcome to A Way Forward presented by Beem Credit Union. I'd like to acknowledge this podcast takes place on the ancestral, traditional, and unceded lands of the Okanagan Syilx people. Our topic today is mentally healthy workplaces, and my guest is CMHA Kelowna Director of People and Culture, Candace Giesbrecht. Now, we're going to get into what is a mentally healthy workplace, how you can get it and maintain it. And of course, we're going to offer you some resources too. You know, Candace, what's really interesting to me about this topic is, I don't know, I'm going to guess like prior to 8 years ago, I thought, and maybe other people thought, that workplace mental health was about an employer supporting an individual who has a mental health concern or a mental illness. And of course, ta-da, it is a little bit about that, but it's also about so much more. So please tell us, what does workplace mental health mean?
So not a small question, really. But I mean, and when we talk about workplace mental health, it could be, like you were describing, mental health in the workplace. So in the case of employees or, what's happening between coworkers and so on. But it also could be trying to achieve mentally healthy workplaces, which has within it this whole bucket of strategies.
A bucket of strategies. That sounds a little bit daunting for any employer or people who are in a workplace.
Yeah.
So like, what are some of these strategies, and how do employers, and I guess the responsibility for the employees themselves, to approach it?
Yeah. And I mean, there are, again, so many different forks in this road. So, I mean, we can talk about the business case and why mentally healthy workplace strategies are good for business.
Okay. Well,
and they are.
Okay. Why? You can't just tease us and walk away.
Okay.
Yeah.
Okay. Well, I mean, there's been plenty of research that looks at the ROI of investments into mental health strategies. And we'll talk, I assume, about what some of those strategies are. But one study just last year that was conducted said that for every $1 invested, I believe it was $1.64 that came back in terms of business impact, positive business impact. And that was after 1 year. And then after 3 years of businesses implementing mentally healthy workplace strategies, they saw over $2 in ROI for every $1 invested.
So what does that mean for a business? So does that mean, like how are they getting back that $2 or $1.64?
Yeah. So, I mean, the ways that they're getting it back are in improved productivity. Oh. So, and the people who are really good at measuring these things do a good job of benchmarking current productivity before they implement some strategies, and then they continue to measure some of the same things. And so, when we're looking at, mentally healthy workplaces or workplace mental health, then there can be both positive and negative aspects of the conversation. And so, when we look at strategies, we can take a focus on what are some of the positive impacts of us looking at this, but also what are some of the negative impacts when we don't. And some of the negative impacts that we might be a little more oriented towards, or, maybe top of mind, is absenteeism, or something that we think about in called presenteeism, which is where a person is there but like not really there,
like on a Friday afternoon in the summer in the Okanagan.
Okay. And there's like happy hours happening all over the place.
Yeah.
So presenteeism is actually more costly in some ways than absenteeism, because the person's there, and we've all had that experience where we've read the same thing 4 times over and we still can't quite get it, or we're sitting in a meeting, but our mind is elsewhere because maybe we're thinking about some of the things that are impacting our mental health negatively.
Okay.
And so, when we think about the mentally healthy workplaces, then there are strategies that could include anything that falls into the bucket of HR or compensation or, benefits, those kinds of things. Mm-hmm. But there are also some of the social activities that happen, or the training that we invest in our leaders so that leaders know how and when to have a conversation when maybe somebody's seeming like they're not themselves.
So we got into this kind of, I took you on a bit of a different path than we were headed, because we were talking about that bottom line piece. And I wonder if employers or workplaces in general understand that there are really some positive and negative impacts to the bottom line if this isn't addressed.
So one of my big pitches is that employers are going to pay either way. So they either pay on the side of investing in some of the prevention or mental health promoting kinds of strategies like training or social gatherings and things like that, or they're going to pay on the side of illness. They're going to start losing staff. Staff may go off on a leave related to a diagnosed mental illness. They may be struggling with coping, or as we also know, mental health has a really big impact on physical health. There have been many, many cases that we've seen and we understand that if a person shows up with heart disease or with cardiac problems, one of the things that doctors and professionals will look at, care teams will look at, is why is your blood pressure high? What's happening how are you managing stress? How are you coping with life? What's going on? How do we get that blood pressure down? If we think about cholesterol levels and bad eating, those have an impact on our cardiac health. But a lot of the times the bad eating happens because we don't have other coping strategies. Those become ways of us medicating almost with food, or just finding those things that I just need to feel good for a minute, even if it's this chocolate bar, right? And so people end up missing time from work related to physical illnesses that may have a mental health cause, or because they need to press pause on some part of their life, and work's the thing that they're most in control of.
When you were talking about that, you were talking about, and that makes total sense. And you're talking about why is your heart rate so high, or or why are you kind of doing that? Eating the chocolate the way you eat, or what have you. It led me to this idea as well, and the question is that, I mean, you're director of people and culture here, so it's when you're in a workplace and you're addressing workplace conflict.
Yeah.
Are you examining this same kind of idea? I mean, not that it's kind of weird, because I feel like you don't want to kind of be like, oh, they're not mentally well. Like, you don't want to turn mentally well into a bad word or some kind of excuse. But as employers, is that a consideration if you are experiencing some conflict, even outside of presenteeism, et cetera, et cetera?
Yeah, workplace conflict is a huge risk area, and it is so tricky as an employer to think about, like, when are those times and situations where we really want to encourage people to just kind of work it out the way that they want to, or feel like they can work it out. Most often, there are so many barriers to how people, or that prevent people from addressing it in the workplace. And unfortunately, there are so many times when unaddressed workplace conflict results in all these other extra super hard consequences. So I know if I've been having conflict with someone at work, maybe I need to have a conversation with someone that's feeling a little hard, it's feeling stressful. The cortisol is going, the adrenaline's going, my sleep's messed up. I may wake up and I know I need to have this conversation with this person. Finally, I see them, but then I'm trying to read the room. There are other people around. Maybe I can't get private, right? And we come up with those, now is not a good time. Oh, they look like they've had a hard day. Actually, they've got a lot going on in their lives. And you know what? Maybe I've got too much of a headache. Today isn't a good day. And so then we leave it. And then it turns into often some escalated situation where, the strategies need to be sometimes more formal. They become escalated. And we're not saying it's easy to talk to a person when it's one of those crucial conversations, but the costs are even higher when we don't. And when we're not addressing things, then also, I start to think, well, work's not so fun anymore because I've got this conflict going on with my coworker or maybe my boss or there are these things that are just hard about being at work. And so, you know what, maybe I just don't want to go in today. Or I'm so distracted by this workplace conflict that, I'm not productive at work. Or I start to go down a downward spiral. Like if I'm prone to anxiety or depression already, or if I'm already struggling with it, then on top of it, there can be some other stories that start going on in my head about, great, another place where I don't belong or I don't fit in, or this person doesn't like her or respect me. All these stories start going, which then becomes this giant spiral.
You have you to use common language. There's a narrative that's going on in your head that is very real to you, but just might be colored a little bit by some other factors. So it sounds like I'm a little angsty even you describing that scenario, and possibly because maybe I can identify and maybe many of us can with being in a workplace that didn't support obviously the mental health of the individual. But let's get back to the talk about what a mentally healthy workplace looks like. Yeah. Because there's also, we hope as individuals, everyone is doing well in their mental health, but there's things that go around in the workplace that need to happen to facilitate that.
Yeah, there sure are. And so thank goodness there are really smart people who've been doing a lot of research for a really long time. And so it's so helpful for, a person like me, and I assume many others, to be able to go, okay, just give me the list that I can refer to, something that at least helps me to guide, because by myself, I'm thinking, I'm wondering, I'm Googling, I'm trying to figure out what lever can I pull that's going to make a difference here. And how do I know if anything's even making a difference? And so there's a group of researchers that's connected to the Mental Health Commission of Canada. Also, there are a number of players, but I'm really proud actually to be a part of a country that has taken this so seriously. And we really have, maybe we weren't the first to be thinking about some of these things, but we really have been working hard as a country at looking at what are the pieces that help to contribute to a mentally healthy workplace. And certainly there are pieces of legislation that have shifted and changed, that have made it very clear to employers that there are responsibilities to ensure psychological safety, not just physical safety. And as well, there's been this research that has come up with a list of 13 different psychosocial factors that contribute to mentally healthy workplaces.
Right. So you just introduced the phrase psychological safety, and that is the language that's being used to describe a mentally healthy.
Yeah.
Okay. So 13 factors. Everyone get their pens out.
Yeah.
But like you say, it's kind of to help you navigate along the way. So what are the factors?
Sure. I'm going to look at my list for this one because I don't have them memorized. I could probably do pretty well, but the first one is psychological support. And so when I'm struggling with something, maybe I have a death in the family, maybe I've had some bad news, or I'm just feeling low, then having psychological support within somebody who cares enough to say you're not yourself. What kind of resources do you need? How can I help? I care. I care about you and this place.
Sounds very reasonable to me.
Sounds very reasonable, and also sometimes missing in a lot of workplaces, right? And it doesn't take much to just say, I care, I notice, I see. Another one is organizational culture. And a lot of people confuse culture and climate, which would be, I think, another topic for maybe another podcast. But the culture is really those shared values and behaviors that permeate an organization. So the way we do things around here, that it you can sort of feel when something doesn't feel like the culture here. And so climate on the other side of that same coin is people's experience of it. So when we look at culture, we're really talking about those values and those things about, what's reinforced, what's celebrated, what's taught, what's within all of those intros and the things that we always start with.
Mm-hmm.
Yeah. So those inform our organizational culture. Clear leadership and expectations. And this one is one of the ones that I usually lead with the most as we support various workplaces around our community. It's such low-hanging fruit. And it's not to say for a second that it's easy, because it often is not. But if we start with, how do you know what your priorities are? How can what are the priorities for this week? Noticing when there's been some role ambiguity, maybe there's been a business has experienced some growth or something like that, then taking the time to spell out, okay, in this one task, who's responsible, who's going to be consulted, who's going to be informed. So it's a version of what's called a RACI matrix, but there are a number of different tools where you can go, this is the direction, who's doing what and by when. And so setting those clear leadership and expectations, many of us have had that experience where it's like, I'm showing up, but I don't know what my priorities are. I don't have a clear sense. Like, you've pointed out the window and said, we're going out the window, but like, are we going to the street? Are we going to the building behind it? Or are we going to the mountain that's way off in the distance? I don't know. And that can be frustrating and hard to landmark and to try and figure out, like, where do I fit and where am I going to make an impact? Civility and respect, psychological competencies and requirements. So do we have the abilities to be resilient? So do we have those skills to bounce back? Do we have the ability to identify and navigate the things that are coming at us? Growth and development. And many businesses, this is one that's maybe a little bit more familiar, but sending someone to a conference can signal to a person, we care about you and in your growth, and we see your value, you're worth investing in. And there's also that opportunity to just stretch our brains, and that can have such a positive impact on our mental health and on the broader workplace. Recognition and reward. Often people think about recognition and reward as pay, and that certainly is part of it, but it's not the only thing. Then within that, we have just different personalities and different people. Like, I recall a time when my boss very publicly thanked me for something that I'd done. And I recall feeling like frustrated that had happened. So part of it was a little bit of embarrassment. Like, I wasn't expecting it, and it was lovely. But I also had this feeling like I just realized that a private thank you is far more meaningful to me than a public one.
That one is so interesting to me, that recognition. That was one of my biggest learnings at my time here at CMHA Kelowna and around workplace mental health. I have a large personality. I mean, I don't seek out public recognition, but I can take it, right? And I'm like, what? Not everybody likes that?
Yeah.
Wow. And oh yeah, because I can imagine in that instance, everyone stops, all eyes turn to you, you flush. Are you expected to say something? What do you say? You got to come across humble, but not boastful.
And also, she kind of had to. She kind of had to thank me in front of everyone. So there's this question of, was it sincere?
Yes.
Right? And so a private thank you, like, I see all the work that you did and it really matters. And so, I mean, I believed that it was sincere, but I really realized that what was most meaningful. And so rather than getting upset about, like, this person should have known, like, that I would prefer a private high five rather than a public kudos, I felt I needed to take responsibility. But those are to say thanks, and a private high five is
all you need,
is all I need, and actually is really important to me. And so being aware of the kinds of recognition and reward, like, not everybody's built the same way, but also finding those different ways that we can express that gratitude. And gratitude, I would suggest, is probably one of the most powerful ways of recognizing people. And yet, having said that, I've also known people that, and this was a mistake on me as a leader. I recall times when I thanked the person privately, believing that was what they wanted and what was going to be most meaningful for them. And yet I completely missed a public opportunity that they expected and were hurt by the fact that I didn't publicly recognize them. And I'm like, I missed that. Thank you for sharing with me so that I know how to recognize you in a way that's meaningful for you. So recognition and reward, involvement and influence. We want to have a say, don't we? Mm-hmm. All of us want to have a say. I want to know that my voice matters. I want to know that I have the opportunity to bring my perspectives, bring my strengths, bring my concerns about maybe some risks that I see. And so that involvement and influence is critical. Mm-hmm. And again, a pretty low cost way to really make a difference in shifting the overall mental health and engagement of your staff. Engagement is the next one. So are people feeling like they're part of it? Are they feeling loyal? Are they feeling connected? Or are they feeling like they matter and feeling like they're, when they show up here, they're given their version of 100%, whatever that is today. They're bringing their best today, and they aren't dreading and thinking about, exit strategies every part of the day. They're really thinking like, I'm engaged. I matter here. Sometimes I think about engagement as a like gears that kind of go together, and when they miss, then everything doesn't run properly. If you think about the inside of a watch or a clock with those gears, like it won't work properly unless everything's sort of working together. And
right.
And to me, when those gears are engaged, that's kind of how it feels when we're engaged within our workplace. I skipped over workload management. I don't want to miss that one. So how much work, like, are we trying to put 50 pounds into a 20-pound bag, right? Like it's those days when we just feel like we're doing so much heavy lifting, we're pushing that boulder up the hill and it just keeps rolling back down. Workload management, super important. Balance. So do I have the opportunity to have the kinds of breaks or pauses, some flexibility maybe within my life and work? And this was another one. I have stories for all these things, but I really remember this one person that I worked with, and I just envied the extent to which they could set boundaries, and that they showed up on time, they left on time, they got all their work done within the allotted time. For me, I'm a little more fluid. If the thing that I need to do is clearest to me at 8 p.m., then I'm just going to do it then, because then I sleep better. But I had to really just understand, trying to make myself into someone I'm not also isn't mentally healthy. Mm-hmm. And we're not all wired the same, but figuring out how do each of us manage our workload, find that work-life balance. All of these things are intertwined, aren't they?
Well, you use that example of the cog, and you used it for engagement, but I see that really that those are they're all part of the cog for that psychosocial factors of a mentally healthy workplace. A lot of these, and you said, are low-hanging fruit. They seem fairly obvious. There are barriers though, and workplaces and employers and employees are finding barriers to this. Like, what would be some of the challenges? I mean, I can imagine of not knowing even how to start. Yeah. But, and fair enough, right? Yeah. Like, that's a long list. And I happen to know there's psych
protection and physical safety.
Yeah.
And then we got
physical safety. That too. But then there's pieces to each of that as well. Yeah. So I can imagine staff turnover, growth or constriction of a company. So, an employer may feel, okay, we're in this groove, we're in this mentally healthy workplace group, and then who knows what? Yeah. The socioeconomic, political, whatever, financial climate changes, things go awry, and they have to start again.
Yeah.
That's really, really tough. And I wonder if there's even, after a while, I wonder how employers are feeling like, gosh, we're never going to get this right. Do they ever 100% get it right?
Well, I guess it depends in the eyes of whom, right? So maybe in the eyes of some of their employees, nope, haven't got it right yet. But maybe in, when we're looking at like, what are we measuring, why and how? And, we haven't even talked about measuring, and there are some awesome free tools. There's a survey called Guarding Minds at Work, which is completely free.
Well, and that actually goes into the measuring, because I was wondering earlier, who determines if it's a mentally healthy workplace? Like, does the CEO, the president say, that's it? We are mentally healthy, and
yes,
my work here is done.
Yeah.
I'm sure that's not the case.
It is not the case.
What is the case then?
Yeah. So, the hope is that there is some kind of measurement, and there are a ton of different, engagement surveys or different versions, but Guarding Minds at Work is evidence-based. So that means it's grounded in research. It's been around for quite a long time, and it's solid. And it measures these 13 different factors. And what we used to do here at CMHA Kelowna, we used to do Guarding Minds annually. We've switched to every 2 years just because it's, just factoring in. It does take a little bit of time and work, mostly because the first step is measuring, but then we want to report back to staff. We asked you to tell us what you thought, and here's what we heard.
Right. And you want to do something about it.
Yeah, we want to do something. And if we were to do 3 things within the next 6 months, what are the things that are going to make the biggest difference? And so hopefully, the investment in this isn't just on HR's plate. Hopefully the entire, senior leadership team has bought in to measuring this and identifying the plan. And then hopefully we also take the opportunity, because, well, Mike Golick, our CEO, he often says there's what it is and what it does. And so what it is you get a scorecard that it's with some traffic light coloring that shows you where you're in the green, everything's looking great. Here's some cautionary areas. But by asking people, how are we doing in these areas? How are you feeling? How's it going? Then just by asking, then we're making an impact. Mm-hmm. Now that impact's going to be short-lived if we don't do anything about it. And if we keep asking people year over year for their input, but they don't really see any real change. But if we say to people, okay, like, and this happened, I don't mind sharing. When I came here a couple years ago, then it was looking like a lot of our staff were at risk for burnout. That's what showed on our Guarding Minds report, lots of risks areas. And so when we dug a little bit further into the results, what we discovered was that there was probably a big opportunity for us that would accomplish both clear leadership and expectations, as well as a little bit of growth and development. And we saw that we could really improve our onboarding processes and just train people better at the start. And so, but we decided which metric we wanted to move. We decided that we wanted to move the ones that were related to burnout. And we wanted to do that by focusing on this one thing and really shining a light on it, and not just trying to accomplish 10 different things and do a, wide and shallow kind of an approach, but we wanted to go deep on it. And I thought we would have got through it within about 6 months, but I can say it ended up taking us close to 2 years before we really dug it, because what we discovered was that job descriptions actually weren't really reflecting what the actual work was. So we did some work on those. And then that had an impact on our job postings. And when we looked at our job postings, then we realized, oh, hey, if we do a better job of articulating in the postings what the job actually is, then we might do a better job of attracting more of the right kinds of candidates that we want. So we've seen reductions in turnover, and we've seen we've seen improvements within these scores. I'm not going to rest if there's even 1% of people who are right. Like these are the kinds of things I've experienced. Burnout, it's devastating and hard. And so we're going to keep going. We will never be done.
Okay.
And we can celebrate that 2 years ago, we identified that this was a growth area, and we decided we were going to tackle it. We were going to do what we could to try and shift this. And I mean, we also had fun while we were doing it, which I trust. There's what it is and what it does. I trust that it also made an impact, because it was hilarious. We had groups of leaders in rooms looking at the job postings, and they were going, "Oh, we need to spend some time." And then what happens when leaders start spending time at the front lines a little bit more and really looking at how things are going, then, I mean, we went in to accomplish these one or two things, and we came out with a list of 10 more things that we really want to be following up on, checking in on, appreciating, celebrating, considering, especially as we look at adding different services or, growing as an organization too.
What's interesting to me about that is you talked about 2 years to address one part of one thing that you saw, which led to this, and this in 2 years. And, this is for a mental health organization.
Yeah.
So it happens and can happen to anybody. Okay. You mentioned burnout. We're going to have you back, have another conversation, because burnout is a really interesting topic to me, and obviously shows up in many aspects of our lives, primarily in the workplace. So we'll have to put a little pin in that and come back.
Yeah.
But there's somebody in a workplace who's senior leadership or an employer listening now. They've just heard about this 2-year experiencing that CMHA Kelowna had, and they're like, "Oh, great. Thanks."
Yeah.
Where do they start? How do they get started with even thinking about implementing or checking to see if they have a mentally healthy workplace?
Yeah, I would recommend the Guarding Minds at Work tool, or even just going to the website. You can just Google Guarding Minds at Work and it'll come up. It'll be the top of the page for you. But there are also a lot of big resources that, like toolkits and fact sheets and links out on any one of these topics. And I remember this was several years ago, and there was a study that was done somewhere in Europe, and it actually was looking at the mental health of elite athletes. Now, all I did with it was I took it to a person in our community, and I said, if we were to replicate this study with your team, do you think we'd find similar findings? And the findings were things like young male athletes were twice as likely to develop eating disorders as a result of being a part of the sport. And young girls, so in this case, it just looked at boys and girls, were 4 times as likely to develop eating disorders as a result of being at an elite level in this particular sport. And so all I did was I just presented the stats, and I said, if we were to run this within your team, what do you think we'd find? And like initially it was like resist. I think we got this. I've done all the things. But then when I just put those stats in front, then the conversation shifted big time. And this person said, we'd probably find very similar results. And then the follow-up is, how can I help? And so I think, to your question around employers, like you could pick anything that you find of interest. You're a senior leader, take one of the stats. I think there's going to be a lot of resources within the show notes. And so have a look, or take a snippet of something that maybe you've heard in this conversation and ask some folks. What do you think about this in our workplace? Because there's what it is and there's what it does. And so sometimes just asking and beginning the conversation, going first as a senior leader, is huge. Stigma is still alive and well. There are so many people who are not asking for the help that they need because they're afraid of what people are going to think. They've had bad experiences when they have asked for help. And it's been minimized or shoved aside, or maybe they were made fun of. Like we don't know what people is. There are a lot of reasons why people don't say, I'm not okay. I'm really struggling. And so if a senior leader is listening, and that could even be something for them to say at a meeting, I'm noticing I'm not myself these days. And I'm thinking, like, I'm wondering if anybody else is feeling that way too. That would take a lot of courage. But when we just begin the conversation, then amazing things can happen.
Candace, thank you so much for being here.
Thanks for having me.
Well, we talked about some resources, and definitely the 13 psychosocial factors, the guarding minds, and a few others we're going to have linked on the show notes, and as well as on the Way Forward podcast presented by Beem Credit Union page on the CMHAKelowna.org website. Beem Credit Union supports mental health initiatives across British Columbia because caring for each other builds stronger, more connected communities. United as one, Beem's founding credit unions now serve 190,000 members across BC.